The year 2023 has been a year of innovations. UPTSU has achieved significant success across community, facility and system level, which has resulted in strengthening and bringing innovations in the realm of MNCH and nutrition. Let's delve into the milestones and strategic interventions of the year. Here are some glimpses of community-level interventions. To improve enumeration and Aadhaar ID generation through eKavach, UPTSU made strategic efforts through a pilot in Gauri Bazar block. Around 1.1 lakh Aadhaar IDs were generated in Gauri Bazar. Based on the model developed, UPTSU is now scaling up block-level support on eKavach across the state in a phased manner. CIVHND sessions have been strengthened to offer family planning, counseling and services to all eligible women and couples. More than 80% CIVHND sessions now offer family planning services on a regular basis. The ICDS department redesigned the hot-cooked meal scheme for almost 80 lakh children of age 3 to 6 years. UPTSU supported ICDS department in designing and development of the scheme for its rollout across the state. The ICDS department has approved a module on aligning AWW and ASHA areas. Block-level training has been completed in 6 districts with around 2,900 staff trained. Implementation-wise, 104 rapid village surveys maps of Chandoli district have been completed and uploaded in the application. Second phase guidelines on home birth, household level interviews were drafted by UPTSU and issued by NHM. A total of 21,430 household interviews were completed in 30 districts. As part of solution design, birth preparedness guidelines were also drafted and submitted to NHM for approval. Here are some glimpses of facility-level interventions. UPTSU has introduced a whole site-on-site training strategy for district hospitals to create a conducive environment for PPFP. Taking forward GoUP's ambition, UPTSU supported the SBA training of 4,044 nurses and ANMs this year across 73 districts. The Gender E-module was integrated into SBA training and all these nurses are now gender sensitized. Revised NSSK training has also been rolled out to strengthen care of newborn in labor room. The Nurse Mentoring Program has reinforced the key learnings of trainings by mentoring 5,214 labor room staff nurses across UP. UPTSU supported GoUP in increasing the coverage of NBSUs by 83 this year, covering all FRUs. 199 nurses of NBSUs have been mentored to enhance their knowledge and skills. To increase the number of active FRUs, UPTSU supported GoUP in providing CMOC services, including C-section deliveries, to 301 FRUs, including 216 CHC FRUs at sub-district level. To improve quality of CMOC services at FRUs, doctors' clinical mentoring has been scaled up to all 75 districts of UP and 16 medical colleges with 268 faculty master mentors. Regional trainings, followed by 2 rounds of mentoring visits for 624 doctors from 76 district hospitals have been completed in all districts, which includes CME sessions for doctors who scored less than 70% score topic-wise during previous mentoring visit. Here are some glimpses of system-level interventions. To eliminate lymphatic filariasis, a D2C campaign named Rakshak was executed by UPTSU in 18 districts of Uttar Pradesh. The campaign was executed with the support of Directorate of Health, PCI, WHO and other partner organizations. The target groups were sent customized messages through beneficiary-preferred communication channels like SMS, IVR call, WhatsApp and WhatsApp chatbot. The campaign was very well received by community. To map health facilities across Uttar Pradesh, UPTSU provided technical support to the health department in development of UPKSK. UPKSK is the single source of truth for all public health facilities. It assigns a unique ID to each facility and is a single point for facility management by integrating data from different systems like Manav Sampada for HR, DVDMS for drugs, FAMS for financials, Care Portal for critical equipment and operational data from HMIS. UDSP was developed for surveillance, control and management of diseases for the Health Department with the technical assistance of UPTSU. All 32,000 plus public health facilities and over 4,000 private facilities have been successfully onboarded and trained to report statewide data on the 12 notifiable diseases. To streamline and make transparent HR recruitment processes, UPTSU supported the development of online recruitment and counseling portals for the Medical Health Department and Medical Education in Uttar Pradesh. These platforms facilitated recruitment of around 800 doctors. Under NHM, a reverse bidding model was adopted, shortlisting 198 specialist doctors based on U-Quote We-Pay model. UPTSU coordinated with NHM, DGMH and DGME to compile the drugs demand for supporting the UPMSC tendering process of 287 essential drugs. Through e-tendering, 273 rate contracts were established, covering 95% of the purchasing needs. The drug specification process was streamlined, emphasizing generic drugs under a single tender, simplifying the overall process. To monitor the functionality of the public health facilities and improve the data-based decision-making, UPTSU along with Piramal Foundation, Hope Center at Swasthya Bhavan with 6 data analysts and 66 24/7 call operators. To augment the performing provider base, mentor-mentee model was initiated across the state with support of UPTSU. Approximately 4,500 staff nurses and ANMs received mentoring for improving skills in PPI-UCD insertion through Each One Teach One approach, and close to 200 doctors received mentoring to refurbish their skills in sterilization techniques. Over the years, UPTSU has been dedicated to aiding the government of Uttar Pradesh in strengthening healthcare system in the state to ensure last-mile delivery of effective healthcare services.